At Arizona Infusion Center, we are committed to improving your overall wellness and health. Are you suffering from treatment-resistant depression, PTSD, OCD, adult ADHD, or chronic pain like fibromyalgia, neuropathic pain, and headaches? Arizona Infusion Center can help. Using the latest scientific breakthroughs in therapeutic infusion protocols, our experts can customize a treatment plan made just for you. Get back on the path to feeling better and stronger today. For more information, visit us at infusioncenteraZ.com or call 602-325-2020.
If I traded it all.
So welcome back, everyone. We just heard this ad, and now we're going to be talking with Anthony Waweru, and he is one of the owners of Arizona Infusion Center. Welcome back to the show. Now, I know for the most part of this beginning and middle of the show, I've been very up. This is going to be very interesting, and I want everybody to listen up, because this may be you or someone that you know that might need something like this. Please tell everybody, welcome back to the show, a little bit about yourself and what you do.
Thank you, Carol. Thank you for having me back. We do ketamine infusions at Arizona Infusion Center. Ketamine, we use it to treat depression, PTSD, anxiety, OCD, and other pain disorders that are not treatable with other pain modalities.
Now, I want to talk to people out there, because I want people to understand that this is not, when we hear IV infusion right now, everybody's thinking of another kind, and this is different. What you do, and you work with people that is a special patient. I want to talk about who that patient is.
Ketamine is an anesthetic drug. It's used for anesthesia, generally, but since the 90s, it's been used on and off to treat depression. It works fast. The effects are long-lasting. With one treatment, the effect can last at least a week or even more. But we have different treatment modalities for the depression, the PTSD, or the mood disorders. Also, we have a protocol for pain disorders, and that one also is different and longer also. But ketamine has been in the market since 1970, when it was approved by the FDA. Lately, the last few years, there's a part ketamine that was approved by the FDA to treat depression, but it's a nasal spray. They kind of modified the real ketamine so that it's approved, so it's effective for the people who can go that route, but not as effective as the full ketamine that we administer.
Now, the person that comes to you, let's say they're dealing with depression, we want you also to understand that it's not just because you're sad. It's way deeper than that. Somebody who has severe depression.
Yes, most of the times the patients we are looking for is those who have what we call treatment-resistant depression. This depression is a depression you have treated for a long time with antidepressants. You have tried therapy, you have seen psychiatrists, psychologists, you have seen therapists, you have tried medication, at least 2 to 3 medications at a time, and it hasn't worked. Or every time you take the medication, you think it's working, then you go back to your depression, and then you change your medicine or you increase your dosage. Those are the patients we're looking for.
Now, when they come to your website, it is infusioncenteraZ.com. You're rated with the Better Business Bureau. You're located in Glendale, and you do free consultations. You have to find out. This is what story is really, what their story is. What are they dealing with, and to find out if they're a candidate for this.
That's true. We want to know the patient better. We want to see what they're going through. We want to see what they have tried. We want to see to make sure they're a good fit for this treatment. We just don't want to treat everybody or anybody. Lately we have seen a lot of people who've lost loved ones, and they've gone through the depression. They have tried treatment, they have gone to therapy. We have seen patients who've gone through car accidents. Here in the Valley, there's a lot of those every day.
Every day.
And those people, they have trauma. They are traumatized. They have PTSD. They can't sleep. They have anxiety. They can't function normally. So we are seeing a lot of that too.
As I would think now more than ever too, in the last couple of years, people have really had a pretty hard go.
That is correct.
And of course, we have people who have been in, when we talk about PTSD, we always think of that as just for people who have been in the service and have seen things. But there's people who are first responders that see things. There are things that people yourself who deal with those kinds of things. People have been, somebody has been raped, things like that.
Yes, PTSD occurs all across all ages, across all genders. It's not just soldiers or police or firemen. It can be women through trauma, even domestic violence that causes PTSD. It can be men through, things they've gone through. Maybe they were in gangs or something like that. That affects them long term.
Mm-hmm.
They've seen death. They've seen people die. They've been in car wrecks. They've been, in situations that they don't want to be in ever again. And these are the people we are looking for because they're having nightmares. They can't function normally. These things affect their quality of life.
And so they would call you direct at 602-325-2020, and they'll do you have to really just find out. You have to find out a little bit about the story. So they're going to do a consultation with you. You can call them and you can talk to them. The treatment, what is it like when they come in? What's that look like when they come in?
So let me go back to the call. Once you call, there are people on the phone who will go through your situation to just evaluate you. Once they certify that you're a good candidate for the treatment, then they'll set you up for a consult with me or the other provider so that we can talk to you how the treatment goes and what it pertains.
And talk to them before you answer the other question too, your background.
Oh, my background, I'm a nurse anesthesiologist or nurse anesthetist. So I've been in the field for over 11 years now.
Yeah, so you're experienced and you know what you're doing.
Yes, I have.
Absolutely.
I have experience. I've worked with ketamine across all ages since I graduated from school.
Mm-hmm.
And I know how ketamine works. I know its science behind it, and I know it works.
And so let's go back to that question is when they call you and they talk to you, and once you have found out if they are a candidate for this, then what does it look like?
So we schedule. The next step is we schedule them for an infusion. Of late, we've been working with some insurance companies. Most of our patients before that have been cash pay patients.
Mm-hmm.
But you just have to check with us to see who we can work with, if your insurance works with us or not.
Mm-hmm.
And then we go from there. So when you come to our clinic, you come in. Once you do the paperwork, of course, we get you into your room. It's a private. We insert an IV in your arm. Once the IV is inserted, we hook the ketamine to the pump. And the ketamine for mood disorders, whether it's depression, PTSD, anxiety, OCD, those conditions, it's only 40 minutes. So you're infused for 40 minutes. And during those 40 minutes, all kinds of thoughts and things can happen. Because you are there, you can have hallucinations. You can feel like you are having out-of-body experience. But if I come and talk to you, you will respond normally. You're not out. We are not giving you an anesthetic dosage.
Do you do that? Do you have to come in and talk to them sometimes?
Once in a while, I'll come in and just make sure you're doing okay.
Mm-hmm.
You're monitored the whole time. We monitor your heart rhythm, your heart rate, your blood pressure,
Mm-hmm.
your breathing, your everything, oxygen. So you're on the monitor the whole time. And we have to do that.
And then when they're done, you have to bring somebody with you. This is not something that you come in and it's a little thing that you're going to do just to get you. This is totally different. This is something where you need to make sure that you have somebody with you.
Correct. You have to have a driver. We recommend you come with a driver. We recommend you don't make any major decisions within 24 hours after the infusion. It's just like going to surgery and having sedation or anesthetic. So those rules apply.
Some of the stories that you've had, I'd like to talk about that. I mean, that's kind of something I think would fit perfect right here. What is it like for people that when they say that they've been through something like this? What has happened before?
Oh, almost every patient that we have treated, they always come back and they say it's life-changing. Most of them, especially PTSD patients, they have come back and they have told us now they are sleeping better. Now they are not having the nightmares. Now they are relating better to their family members. Some of the anxiety depressed patients, some of them now are up and about, socializing, moving around, doing things they love to do in life.
And you said that you have dealt with children before. How old is the youngest that you work with?
Right now at our center, we have, if you are under 16 and your parent thinks you need the treatment and you qualify for the treatment, we still can treat you, but under parental consent.
Sure.
And your parent has to be with the kid.
You know, and I'm going to say this because right now we want people to understand this is for somebody with severe anxiety, severe depression. And there's kids out there that are dealing with that.
That's true.
And, you know, there's help out there. And the only way that you can know if something like this works is if you had that consultation and talk to Tony and find out what are you a candidate? What's going on? Let's see if this would be the right step. And if you have been trying over and over and over with different medications, and you called that what when somebody hasn't worked?
Treatment-resistant depression.
People don't even realize that you might be having that, and you've tried so hard, and you just feel like nothing is working, and you're at your wit's end. I know somebody who I think would have loved to have been able to have their son talk to you, because I know what you're talking about. They did, and he was in so much pain, and we're going to talk about that.
Carol, there's hope. There's hope.
There's hope out there. And
yes.
So the phone number to call, it's 602-325-2020. Go on their website. They're rated with the Better Business Bureau. They do free consultations. It's infusioncentraz.com. Hang tight. We're going to be back in just a minute.
Peripheral artery disease, or PAD, is a growing epidemic. Many patients will end up with unnecessary amputations due to delayed treatment or being uninformed about their options. If you or someone you love is facing a leg, foot, or toe amputation due to complications from PAD or diabetes, you can still visit Modern Vascular for a second opinion. With 4 clinics in the Phoenix area, Modern Vascular can determine if an outpatient procedure could give you the hope you are looking for. Learn more at modernvascular.com.
If you are thinking about a reverse mortgage, you must stop and listen to this. Call Mike Allen now at 602-423-3996. No origination fees, and you'll receive a credit for your appraisal and counseling fee at closing. It's so important to pick the right broker. It comes down to the fees that you are charged. So call Mike Allen at 602-423-3996 or go to myreverseteam.com to get all the answers to your questions risk-free. Not all borrowers will qualify. Lonatic LLC is a licensed mortgage broker. Arizona license number 0936435. Michael Allen, NMLS ID 5390966. Lonatic is not acting on behalf or endorsed by a government agency. Equal housing opportunity lender.
Are flocks of birds and pigeons steadily gaining the ground in the battle for your home? Ritterbird Pest and Termite has redefined bird control in Arizona with proprietary materials and installation methods that are the best you'll find anywhere. With prompt response times, easy and flexible scheduling, and reasonable rates, our always courteous and dependable staff is here to serve you. Residential or commercial packages. To schedule your free estimate, call Ritterbird Pest and Termite today at 623-587-0125. That's 623-587-0125.
KFNX Cave Creek.
Instead of saving your loose change in a jar, start saving it in your own personal app with SaveCoins. Become a SaveCoins saver by going to the App Store and downloading SaveCoins today. With the SaveCoins app, you can instantly find out when your cash has been deposited. Finally, there's an easier way to save your cash. No delay. Download the SaveCoins app today to become a SaveCoin saver. For more information, visit SaveCoins.com. That's SAVCoins.com. SaveCoins, an easier way to save physical cash.
My name is Ted Watkins. I'm an enrolled agent before IRS. I have been on Carol's Show, Networking Arizona, for over 8 years. Carol's Show is by far the best marketing investment I have ever made. All self-employed entrepreneurs should call Carol immediately. Call today. You will not regret it.
What if I told you that getting Medicare coverage doesn't have to be a complicated process? Are you tired of being confused with the many coverage options available to you with Medicare? At Tapestry Insurance Group, let us help by taking the confusion and complication out of your Medicare options so you can get the coverage you need. Some available plans have no additional premium and may help lower your out-of-pocket costs. There's never a cost for a consultation with one of our licensed agents, so don't delay. Contact us at 602-541-7656 or visit tapestryinsurancegroup.com.
If I traded
Welcome back, everyone. You are an anesthesiologist. That's really you know what you're doing here, and we want to talk about the professionalism of what it's like coming to you, right, as opposed to, and why you do it at your center only. And I want to talk a little bit about how safe it is. I think a lot of people are going to obviously want to know that, and how you are there, right there on top of everything while you're, doing the treatment.
Oh, correct. Carol, we have to do these treatments in a safe environment where you are monitored, where your vital signs are monitored on a minute-to-minute basis. You need professionals around you. You need also a place where you have they have all the backup and emergency medicines, just in case of anything. Otherwise, ketamine is pretty safe. We just do that as a safeguard to make sure that everybody is safe. They go home better than they came in. In our center, we have an emergency cart. We have the suction. We have all the medicines for nausea and all that, high blood pressure if it goes out of work or something like that. Because some of those are some of the side effects that ketamine can cause. Mm-hmm. And so we know how to treat those conditions such that we treat them right there before even you leave. If that happens, we've never had an incident like that. Once in a while we have somebody getting nauseated, but we always pre-treat everybody for nausea.
It's non-addicting.
Ketamine is not addicting at the dosages we give it for and for the purpose we give it for. It has been abused in the past, don't get me wrong, but at our center, the way we do it in a way that we give you the maximum dose so that it can last you for the longest time.
So how long does it last?
As I said before, it can last anywhere from one dose can last a week, but we give a total of 6 doses to begin with for everybody who is starting the ketamine treatment anew. So 6 doses, that should last at least everybody a month without the symptoms of whatever we are treating it for.
Now, when you have done everything, you're at your wit's end, and you're dealing with depression, and there are people that are so severe they cannot get out of bed, right? They stay in bed, they can't function. We're talking about that kind of a person.
Correct.
Somebody who has dealt with PTSD, even if it is something that you haven't served, but you have dealt with, like an accident, you've seen death, you've seen these things, you're dealing with things. Been, let's say we've said this before, been, raped or what have you. They're children too, and you said the youngest is 16, and they're dealing with, when you have somebody that you know, and you know those signs and who they are, maybe it's you or someone that you know, let them do a consultation with them. It's a free consultation, and find out, are you a candidate? That's the first thing, is to find that out. Their phone number is area code 602-325-2020. They're located in Glendale. Their website is infusioncenteraz.com. They do free consultations, and they're rated with the Better Business Bureau. I want to talk about pain. Fibromyalgia, big time. People that have that. But you also, people have sciatic nerves. We're talking about severe pain that's they've had it forever, right?
Yes.
But you also mentioned the last time that you were on, people that are amputees. Mm-hmm. That have that pain. It's that it's like it's not there, silent. I don't know what you call that.
Phantom limb pain syndrome. Mm-hmm. Mm-hmm. So actually, I have one gentleman. He's from up northern Arizona. The only thing that treats his pain is ketamine. If he doesn't get ketamine, he has to go to the emergency room because the pain is so excruciating. And if he goes to the emergency room, they have to give him ketamine, because that's the only thing that works. So that's the way he deals with his pain.
And so instead of having to go to the emergency room, where that in itself, it's not good to have to do.
Exactly, because at that time you are at your wit's end, and you don't have another option. That's the only thing that can treat the pain.
Right.
So you have to go there to get that quick shot to relieve the pain. But they give it IM, not like we do infusion-wise. Then he goes home, then another 2-3 days he will be back to the emergency room. But when he gets the infusion, it will last him longer, at least a month. Then he comes back, he gets what's called a booster, then it lasts him another month.
Oh wow, that's amazing. You must what you do. It must be so fulfilling,
It is.
Rewarding is the right word to say.
It is rewarding.
Yeah.
Every day, because you can see the results. When somebody comes in, they are down, you can tell their demeanor, you can tell, how they look. You can tell really they are suffering. But after they are done with the infusions, that person comes back a different person. They are smiling, they're jovial. Even their family members are happy.
You know what? When somebody in your family, or even a friend, and you know somebody like this, it's terrible for everybody concerned.
It involves the whole family, actually.
Do you coordinate then a patient with a health provider? I mean, how does that work? Do you help them out with that too?
Yes. Right now we are working with other providers for referrals, and also so that they can recommend their patients to come to us. And if you are a provider out there and your patients have gone through the treatment and it's not helping, ketamine might be an option for them.
Do you follow the patients afterwards? How does that work?
We always follow up on our patients with a phone call just to make sure they're doing okay. So every time a patient is treated at our center, we always call them and we make sure that they're doing fine. If they need a booster, they tell us. If they are doing fine, that's it.
And give me another story, let's say, for people, talking about pain. Okay, you said this one guy, and so many people are in pain. Fibromyalgia, I mean, there are people that are dealing with that it can be riddling to them.
Yes, and fibromyalgia is real hard to treat. You can treat fibromyalgia one section of your body. It can be your back, lower back, mid back, upper back, neck, can be everywhere. And this pain is so hard to treat for everybody. So what these patients do, they are coming in. I have a lady who comes actually on a monthly basis for fibromyalgia. Actually, two ladies. And the infusion lasts a little longer. It's about 2 hours for infusion time. And for the whole month, they are pain-free.
So, and during that time, and we also want you to please understand that this is not the kind of IV infusions that you think about,
No.
I want people to understand that, because now a lot of people hear that and they go, well, that's, this is very different.
It is different. And also, ketamine can also treat migraines that are not treatable with medications that are so bad. You've tried everything in the world and your migraine don't go away. We use the same protocol as for fibromyalgia, and it helps with migraines also.
That phone number to call is 602-325-2020. The website is infusioncenteraz.com. But people need to understand that this is something that they need to find out, is it going to work, right? And they need to understand that it is safe, but there are things that can happen. For instance, if the way you do it, it is not going to be it can be addictive in any way.
No, it cannot. It cannot be addictive. It's not addictive at all. It doesn't have long-time side effects at all. So the only side effects are what you feel when the infusion is going on. After that, nothing is expected out of that.
And whether it's you or someone that you know, and we all might just know somebody who's dealing with, we're talking about a severe situation, depression, anxiety. There's a lot of people that deal with anxiety, PTSD. What else?
Also, we do ketamine for the phantom limb pain. We do ketamine for CRPS, that's chronic regional pain syndrome. So ketamine is good for those conditions, and the ketamine for pain in a condition is a longer treatment. So you have to prepare yourself to be there for at least 2 hours. It can even be longer than that.
And
but for the pain, mood disorders, it's only 40 minutes.
But people, please understand too, this is not something where you just come in and you leave and you go. And you go home on your own. You need to make sure that you bring somebody with you, right?
Correct.
And when they go home, what is that like for them? Do they kind of just relax in bed for a little while, or what happens?
We just recommend that they hydrate and they eat whatever they need to eat, and they just relax for that day.
And you
so
know
don't
what?
plan major things that day.
But what a difference. This is life-changing is really what it is. You said that in the beginning. This can be life-changing, whether it's you or someone that you know. Their phone number, 602-325-2020. They're rated with the Better Business Bureau. Their website is infusioncenter.az.com. They do free consultations. Please, you know, one of the things that I want people to know is there's so many people out there suffering. There are answers, and this is where you can find it. Again, that number is 602-325-2020.
If I traded it all